At the National Patient Advocate Foundation, we listen, we learn, and we act. We advocate and we help others become advocates for equitable, affordable, high-quality healthcare. Advocates for ourselves and the people we love. Advocates for our communities. Advocates for meaningful change to our healthcare system. The National Patient Advocate Foundation brings the voices of patients and caregivers to the center of all our work to make healthcare truly patient-centered and equitable. We do this by working with partners all over the country, co-creating programs with individuals and organizations who are deeply rooted in their communities, who understand what those communities need to improve their healthcare access and experience. We take on key issues, difficult ones, through our community outreach programs, workshops, and events like Policy Consortium. What does it mean to redefine health literacy? How do the cost of care influence access and quality of care? How can we make trust between patients and their providers a two-way street? How can we help patients navigate our complex healthcare system? We believe that everyone, patients, caregivers, and healthcare providers, has a powerful, unique story, and we bring people together to tell those stories and to listen to them. We use story slams, podcasts, videos, our extensive website content, and bring key issues and patients' voices to the media. We work to help people improve their advocacy and communication skills through our unique advocacy training curriculum. We provide resources for patients and caregivers to help people understand issues that impact their health and their care. NPAF is the advocacy affiliate of Patient Advocate Foundation, a national nonprofit organization that has provided direct patient services, including case management and copay relief, to over 1 million patients nationwide. Effective advocacy means meeting people where they are, in their communities, to bring about meaningful change to our healthcare system. And at the National Patient Advocate Foundation, it means amplifying the voices of patients and healthcare providers to demand affordable, accessible, equitable healthcare for everyone. Listen, learn, act, advocate. Be brave.
Good afternoon and welcome to Story Slam. My name is Jamie Trotter. I am the Associate Director for Patient Advocacy and Engagement at NPAF and your co-host for today. This marks the return of this annual event for the first time in 4 years. We used to convene Story Slam annually in person, but due to the pandemic, we are trying out this new virtual setting for the first time to have greater reach and participation. So if you don't mind, would you please drop in the chat where you are joining us from? We want to hear from you. And as you heard in the opening video, the mission of NPAF is to amplify the patient voice. We do this through education, through curriculum, and through events like today. And to quote my colleague, Caitlin Donovan, we like to call ourselves the megaphone, not the teleprompter, which I think is a really perfect analogy in describing our role to provide each of you with tools, resources to use your own voice to tell your own story and become active participants in your healthcare, in your decision-making, and to advocate on behalf of yourselves and others. I'd like to thank everyone, each of you, for being here. I'd also like to thank all of our speakers for being brave and sharing their stories today, and also taking time out of their busy schedules to be here. Our role today as listeners is to just be present, to provide a safe space for our storytellers. We welcome your thoughts, your comments, and your reactions in the chat. And lastly, I really would like to send a special thank you to Nicole Brandow, who is our fall intern, who provided so much work behind the scenes in relaunching this event. And now I have the distinct honor in welcoming our co-host, Dr. Rita Sharon. Dr. Sharon is an internist and literary scholar at Columbia University in New York. She is one of the founders of the field of narrative medicine. Dr. Sharon chairs the Department of Medical Humanities and Ethics at Columbia's Medical School and directs many narrative medicine projects throughout the university. Her work is published in major medical and literary journals, and she lectures extensively internationally. Speaking of lectures, you might recognize her as faculty from our storytelling curriculum. And now I'll turn it over to Dr. Sharon.